Hello, the patient I will be presenting today is a 15-month-old female. Chief complaint. Mother states that patient has been pulling on her right ear for the past 2 days. History of present illness. Patient presents with fever times 1 day. Per mother, patient has been pulling on her ears and has become increasingly fuzzy. She also has stated a decrease in appetite, and her fever ranged between 100 and 101 as of yesterday. Location, her right ear. Timing, symptoms were a total of 2 days, the past 2 days. Associated signs and symptoms, mother just has stated that decrease in appetite. As for her past medical history, child has no known allergies, no current medications, no hospitalizations, no surgeries, and her immunizations are up to date. For family history, patient does have an older sibling. Mother reports no health problems for herself or the father. Her paternal grandparents are deceased, and maternal grandmother has history of thyroid cancer, and maternal grandfather has high cholesterol. For social history, patient does go to daycare full-time, Monday through Friday. Review of symptoms. General, mother states child has had no recent weight loss. For eyes, no drainage was reported, no redness or itchiness. No, ears, nose, and throat. She does report nasal discharge, but no nosebleeds, sinus congestions, or reports of sore throat. No dental problems, hearing loss, or changes. For cardiovascular, mother denies any unusual shortness of breath. Child remains active for her age-appropriate activities, reports no chest pain. Respiratory, no history of respiratory infections, shortness of breath, wheezing. For GI, no abdominal pain was reported, no vomiting or nausea. Mother does state loss of appetite, but does deny any diarrhea, constipation, or vomiting. For musculoskeletal, denies any recent falls or injury. Neurological, mother denies any noted gait abnormalities. For endocrine, weight is appropriate, but mother does state child appears more tired as of lately. For objective data, the vital signs were within normal limits at the time of the visit. No fever and height and weight are appropriate for each. General, child appeared well nourished, well developed for age, is physically active. Eyes, pupils were equal, no drainage noted. Ears, nose, and throat. Tympanic membrane was normal to the left ear, but bulging and exudation noted to the right. Nasal drainage was present, but mucosa appears pink, moist, no lesions or masses present. Cardiovascular, regular heart and rhythm noted, no murmurs. Respiratory, breath sounds were clear and equal bilaterally, no retractions or wheezing noted. GI, abdominal, bowel sounds were heard in all 4 quadrants, soft and non-tender to palpation. No masses noted. Musculoskeletal, patient demonstrates full range of motion with no signs of pain. Neurologic, alert and oriented times 3, no signs of focal, motor, or sensory deficit. And hematologic, lymph nodes noted palpable, no tenderness or masses present. For the diagnosis, we diagnose this patient with otitis media to the right ear. Other differentials that were discussed included allergic rhinitis, acute upper respiratory infection, and acute sinusitis. As for the plan of care, amoxicillin 80 milligrams per kilogram per day for a total of 10 days, as well as ibuprofen 50 milligrams per 1.25 mLs every 6 to 8 hours as needed was prescribed. For education, we encourage the parent to do supportive care, such as increasing their fluid intake. We discussed about ways and how to incorporating the child to get those fluids in, because the child does show a decrease in appetite and is intaking those solid foods. We just discussed ways on how to increase that fluid intake, how to remain hydrated, and the importance of maintaining his hydration. We also reinforced the importance of completing the entire dose of antibiotics, regardless of how the child feels after a few days. And we talked about how to properly clean a child's ear and try to prevent using Q-tips. As for follow-up, we did want to see the child in 2 weeks. We did tell the mother to bring in patient earlier if needed, if symptoms do become worse. As far as for the debriefing, I would agree with my preceptor on her plan of care for this patient. The medication she prescribed were appropriate for her age and weight, and the education we provided to mom as well was geared towards her diagnosis and something she could incorporate to help prevent this from happening again. So as the PNP, I would agree with this and would have prescribed this myself. Thank you.